The scientific and medical advisors in the UK advising different measures than their counterparts in other countries. France, for example, as you well know, yesterday said schools and colleges to close.
I think broadly, actually, the scientific community is aligned on the measures that need to be taken, and the question is around at what time and in what way. And so, as we just said, the first set of measures are actually rather large. We've just asked a lot of people to isolate, stay at home if they've got symptoms of mild upper respiratory tract infection, cough or fever. That's a big change. That is the intervention which is going to have the biggest impact at the moment. We've also talked about the possibility of whole households staying at home if one person's got it. That may come in later. And importantly, we're also talking about making sure that during the peak, when people are most likely to get infected, the elderly and vulnerable are properly protected, which will be over a many-week period. This is not a short-term thing. This is going to go on for weeks. So there are things that will come in due course at the right time. And of those, just to deal with the schools one, closing schools is a very effective way actually of dealing with pandemic flu. It's often a way to deal with it. In this disease, the role of children is less clear in terms of spreading the disease, and you would have to close the schools for a very prolonged period, so months, 4 months or so, in order for this to be effective. It's inconceivable that those children are not going to mix anyway, and of course many of them may also be sent to be looked after by their grandparents during that period. The consequences of those have other impacts, of course, on this illness. So although school closures may be something that needs to be done at some point, we need to get these other bigger, more impactful measures in place first.
So if closing schools is relevant to how you're going to tackle it more generally, it seems to be that you're saying that it's because you don't think people would take it seriously for long enough, rather than it's relevant. It could be done now, and that would be useful, but you think that people would not be ready for that and couldn't sustain it over a period of time, along with large gatherings, for example?
No, I think with large gatherings is a different point, but I just want to be clear. There are 3 interventions which we think have the biggest impact, and those are the 3 we're focusing on getting in place. And they are big, and they are the things that we need to make sure we get at the right time. Schools would have a lesser impact than those, and need to be done at the right time of the outbreak in order to have the effect. And that right time isn't yet, doesn't mean it won't come, doesn't mean that isn't one of the things that we will keep in absolutely regular update. Mass gatherings are a different question, and most of the infections will be spread by small groups. Actually, the most likely people that you get infected by are the people you know best, your friends and family that you come into contact with a lot. The mass gatherings, closure of mass gatherings, one person who's infectious can either have a high probability of infecting a small number of people in a small space, or a very low probability of infecting a larger number of people in a big space. So that closing mass gatherings may have an effect on its own. It's a relatively small effect, actually really quite small compared to the other things we're talking about. But again, on its own, doesn't make a difference and isn't one of the top things that you need to do to try and control this sort of epidemic. So we need to get the important things done first and properly implemented. Those are the things that will really create the social distancing that are so important to try and break or reduce the transmission of this disease.